Beer me, Blazer.
All right, so we could jump into another hip injury right here. You got Jarvis Landry from the Browns. He has another hip injury right here. I was kind of looking into this one because, I'm a big Juice fan. Is this kind of the same exact injury as Chris Carson, or is it a little different? Because I think he had something with the labrum as well, right?
Yeah. His is a little different. His is kind of like how I explained Dalvin Cook's labrum, with the rubber gasket. It's like that same thing, but it's for the actual hip joint. But he underwent surgery. They cleaned it up, and I think this might be his first labral injury. So it's not like this is like a repeat thing, kind of like Dalvin. But there's degrees with tears, right? 1, 2, 3, how severe it is. I couldn't find how it is, but usually when someone kind of goes through arthroscopic hip surgery where they don't fully cut you open, they kind of use robots to help kind of, sew it up. They can start, jogging after 3 months. And they can start doing high-intensity sports, kind of like football, with 5 to 6 months. And I think that will kind of set him up for a return right away. And he's had no setbacks so far. I think I saw a thing on social media where he was doing some kind of crazy PT workout, and everyone was kind of talking about how good he's doing, stuff like that. So he has no setbacks so far. So if it keeps going on, he should be fine. He should heal up great, and he should be kind of ready to go for the new season.
As far as reoccurrence, is that more? Is this a hip injury where it's more prone to reoccur, because due with that whole joint thing, like you're talking about the shoulder and labrum? Is that somewhere it's once it gets injured once, it's not as strong? Is this kind of the same thing with that?
It's a little different with him because he doesn't have the history of getting injured multiple times like Dalvin does. His could have just been a traumatic hit, and it could have just done it, and it's not like it'll repeat. And a lot of the research studies show, recoveries for these labral hip injuries, especially for someone who is not prone to being always hurt. They're pretty positive, so I think he should be fine going back to the season.
I mean, he finished the whole season. I mean, and, obviously it was probably hampering him, and he was injured. But I mean, for him to finish the season and have the season he did, I mean, he outperformed OBJ. You would like to think that, having the off-season surgery, a lot of positive things that the medicine man, a.k.a. Dr. Coochie, is saying right here. So it sounds like he should be good to go, right? So, what's your injury risk on him, 1 to 10?
I'd probably say about 4, 3, 4-ish. I mean, he's gone through the surgery. It's sewing up well. It's healing well. His PT, he's doing explosive things in PT already. I can't see it happening. If it happens again, it's just like last year. It's it's not like you plan it, or it's because he got injured before. It's just one of those accidents that happens.
For sure.
So mild and good news for Landry.
Yeah, good news for Landry. I like hearing that. It's
Yeah.
my boy.
It's just I feel like it's really good to just get that perspective, just because I feel like when I hear hip injury, I'm like, okay, well, fuck that. I'm not touching him.
Yeah.
Versus when he breaks it down like this, it's nice.
Yeah.
But like he was saying,
100%.
there's so many times you'll see he has a hip injury, and it's like a vague term of okay, well, what is it? Is it a fracture? Is it the labor? There's so many different things that it could be. So it's nice to kind of really dive in and hear what he's talking about, and
sure.
understanding the process and recovery time and stuff like that.
Because we'll just be yeah, he's got a hip, bro. And,
I'm about to start talking like a doctor to people. I'm about to be like, listen, the labrum, it's no big deal. I'm about to use a tee. I'm going to use a golf reference. I'm going to be like, listen, it's just like you put the ball on the tee. Listen, I got you. Just start
you
talking.
golf, right?
Yeah. Like you golf, listen, let's put the thing around the tee. That's your labrum.
Dre, you're not a doctor of coochies?
No, I'm just a regular doctor.
He's a super pooper doctor.
Yeah, I'm more of like a butt doctor.
He's in the gluteus maximus.
Yeah, no COVID with that.
I said colon.
But speaking of hips, I feel better about Jarvis than I do about Carson. I think Carson will be fine, but I mean, with the position, Carson's getting hit more than Landry's going to get hit.
Yeah.
Yeah.
Oh, yeah, I thought the same thing. I was like, yeah, like you said, fractured hip just sounds so vague. I was like, damn, he's done.
It could be anything, yeah. I mean, I don't really know where in the hip he broke. I mean, that could really do it.
Man, that clip was informative, huh? Well, there's plenty more right here. if you click that. Also, go ahead and subscribe right there.